I'm Dr. Joshua Ramsey, and I will be presenting the first reported case of tumor lysis syndrome in a metastatic breast patient treated with ribociclib. Tumor lysis syndrome is a life-threatening disorder caused by the overwhelming release of intracellular products by tumor cell lysis, leading to acute kidney injury. While most common in hematological tumors, it can rarely occur with solid tumors. To our knowledge, it has never been documented in a metastatic breast patient treated with ribociclib, a cyclin-dependent kinase CDK4/6 inhibitor. An 84-year-old female with a history of breast cancer presented to the hospital on September 16, 2020, with progressive fatigue, cough, and dyspnea. The patient was previously diagnosed with stage 2B hormone receptor positive, HER2-negative carcinoma of the right breast in 2018, status post right radical mastectomy, and 3 cycles of docetaxel cyclophosphamide, which was stopped due to intolerable toxicity. The patient was on year 2 of adjuvant hormonal therapy with anastrozole. The patient had a telemedicine follow-up with her oncologist in July 2020 and is reported to be in remission. Chest X-ray on presentation reported right mid to lower lung opacification with a small right pleural effusion. The patient was started on empiric antibiotics and admitted to the medical floor. CT scan on day 2 reported moderate right-sided pleural effusion, mediastinal lymphadenopathy, and a right breast mass measuring 3.2 by 3.4 centimeters with diffuse large hepatic lesions correlating with metastatic disease. The patient was transferred to the ICU after becoming febrile and tachycardic with progressive dyspnea. Thoracentesis was performed on day 4, and 1.4 liters of straw-colored fluid was removed. Pleural fluid cytology was negative for malignant cells. The patient underwent right breast mass excision on day 10. Pathology reported infiltrating ductal carcinoma, ER positive 100%, PR negative, and HER2 negative, Ki67, 70%. Fulvestrant was started on day 10. CDK4/6 inhibitor therapy was ordered the same day, but was delayed pending insurance approval. The patient remained in the ICU on 2 liters nasal cannula. The first dose of daily ribociclib, 600 milligrams, was given on hospital day 16. The patient's metabolic panel was followed daily in the hospital. The development of tumor lysis syndrome was evident on day 23. Rasburicase was started on day 23 and ribociclib was discontinued. Unfortunately, later that day, the patient went into shock requiring vasopressors. On day 25, the family elected to transfer her to hospice with comfort measures. You can see in the table here the Cairo-Bishop definition of tumor lysis syndrome. There is both the laboratory and the clinical definition. The laboratory requiring at least 2 of the 4 following: uric acid greater than 8, potassium greater than 6, phosphorus greater than 4.5 in adults, and a calcium less than 7. Again, that requires 2 of the 4 laboratory changes within 3 days before or 7 days after cytotoxic therapy. Here you can see she was started on day 16, but by day 23, her potassium had risen to 6.8, her phosphorus to 7.8, and her uric acid 11.3. Therefore, she met 3 of the 4 criteria for laboratory tumor lysis syndrome. Clinical tumor lysis syndrome requires an acute kidney injury with a creatinine rising by at least 0.3. Her creatinine rose from 0.7 to 1.4, therefore meeting criteria for clinical tumor lysis syndrome as well. Tumor lysis syndrome has rarely been reported in breast cancer following therapy with gemcitabine and cisplatin or carboplatin, as well as fluorouracil, epirubicin, and cyclophosphamide. All 3 patients had hepatic metastasis, which our patient had as well. Upon discussion with the ribociclib representative, reviewing FDA labeling and extensive literature review, we were unable to find any previously reported cases of a patient developing tumor lysis syndrome following therapy with ribociclib. Here you see a CT scan showing a right-sided pleural effusion, a right breast mass, hepatic metastasis, and pathology included as well. Thank you.